So yeah, we hopefully need to get a better system in that we send out the questionnaires before. So I'd like to do them almost a week before the appointment and then again at the time of the appointment, so we can try and get a baseline over time, because it does, you know, these are diseases that do wax and wane. So we, you know, you want to try and get as representative a picture as you can. So we do use some questionnaires to rate the pain. We do usually use a quality of life scale to give us an indication. You know, it doesn't give us hard numbers. You know, it doesn't say, oh, this is, you know, terrible quality of life, we need to have a serious discussion. But it's just, it highlights areas that we might need to focus on and make sure that we're catering to those. So we'll do those, usually chat for half an hour or so to get a full history and try and understand, you know, what makes the disease worse, what makes it better, you know, any medications that what diagnostics we have or haven't done, and whether those are an option. And then usually by that time, you know, we've been feeding the patients a few treats and things, so they're a little bit more relaxed when I get to hands-on and get to assess, you know, joint function, muscle mass, muscle tension, joint range of motion, all those kinds of things that we assess in looking for pain, you know, and trying to subjectively, but with a bit of a clinical hat on, identify painful points. So then once we've done a history, you know, we've done a physical examination, we can then talk about whether or not I think any further diagnostics are warranted. You know, in some cases that might be, and people are happy to go for that. In cases, people think, oh, actually, I don't want to give my older dog a general and undertake more investigations. I just want to try and treat what might be the most likely thing, or what you think is the most likely thing, you know, and that is a equally valid approach. It can be, you know, sometimes it can be helpful if we can do the investigations and get a clearer diagnosis. It might help guide our treatment a bit more. But if we're suspicious on the clinical exam that it's arthritis, you know, arthritis is a very common condition, so there's nothing wrong in treating on the basis of the clinical signs and clinical suspicion that we've got an arthritic patient. And then, but, you know, in that kind of situation, we just need to be mindful if we're not getting the kind of results that we would have hoped for, we do reconsider the diagnosis.